Hello, hello, hello. Hi, everyone. My name is Aisha, aka Nurse Aisha. Welcome to this Sunday edition of live streaming with me. I'm a registered nurse living and working here in Sweden. And I am here on YouTube to spread awareness on preventative health so you can get the tools that you need to better your health. That is my mission here on YouTube. So, we're talking everything preventative health on my platforms, whether it's here on YouTube or it's on Instagram, TikTok, or Facebook. You will find health information to better your health, mainly preventative health methods on how you can apply this in your life to better your health and your lifestyle, which is associated and connects with your overall health. So we're going to wait for everyone to drop in one by one. And we will get started basically. Let's see. Anyone is watching. So welcome to a new month. Welcome to June, the official summer month over here in the Nordics, in Sweden, mainly where I'm at. Current weather, it's 26 degrees Celsius. It's hot outside. It's really hot. It's beautiful. So it feels kind of sad to stay inside, but we have to spread this information. And we can enjoy the weather afterwards. For those of you that are not able to join me right now, you can watch this live streaming afterwards, or you can watch on your phone right now as I speak. So yeah, today's topic is a Q&A where I've picked up questions from my platforms, the different platforms that I have. TikTok, Instagram, and some here on YouTube. Frequent asked questions that I thought I would answer now in this live session because it's kind of sometimes it feels kind of sad that one person asks a question, an important question actually, usually, and they only get the answer. Unless it's a personal question regarding their own health, that's fine, but usually it's general questions, or sometimes even some of them are suggestions on what I should talk about on this platform, what they want to hear about. Someone has talked about me talking more about endometriosis and stuff like that. And the thing is, I did talk very much about women's health and diseases that affect us women in our reproductive system very much in the beginning of this channel. So you can always go back and watch these videos, but I will do updates on most of the videos that I did in the past. I've seen a need to spread this information, and this is information that never gets old, basically. So just a little touch up, updates with the new subscribers, the over 1,000 followers now. Which reminds me, I have to give a special shout out to Mara team Mara, that has got me this far. Amazing team. You guys are so consistent and so supportive of me. I am so grateful for that. There's people coming in still now subscribing because Mara supported me and gave me the shout out. So thank you so much, Team Mara, and Mara yourself. I am Mara here on YouTube. That's his YouTube name. Channel here in YouTube. I am Mara. It's amazing. You guys are so great. And some of the questions are actually from you guys. I've seen you also on my other platforms on Instagram. Many of you are on Instagram following me and supporting me. So thank you so much for that. Um, I am forever grateful for your support. I am really. So, still waiting for people to get in, but we will start the Q&A session because I'm excited. I'm really excited. Um, yeah, so one of the question is one of the questions is from the first question is actually from my TikTok. And on that video is my most watched video on TikTok, and it keeps on. I am really interested to go into that video and just learn what I did in that video to make it so popular. And so I think it's over 1 year old now, because it was actually filmed around this season, probably May or April or maybe even June. I'm not quite sure. I have to look at the statistics and all of that, the details of that video. But it was a video on hay fever symptoms and treatment. I don't even think I went into the treatment so much. So it was a short video, very short, but I think it has over like 20,000 views right now, and people are still commenting. Obviously, right now is the season, so people are seeing it again. But I've had questions and comments on that video, even through the winter seasons. So it's really amazing. I really love your support. For those of you that have seen the video and are on TikTok, it's a really popular TikTok video that I made. Very, very short. It's not, I think it's even less than a minute. So, people need this information. People want quick information, that I have noticed. But there's just something. There's also, the factor of maybe the music. I don't know. But it was really, really quick. I spoke very quickly, not, the pauses or anything. It was just ding, 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 ding. These are the symptoms, and this is how you should treat the symptoms, I guess. So that question was just recent. So someone went on there and asked me if I'll read the question. Is it possible to develop hay fever if you've never had it before? Because I never had it before. I now have all the symptoms apart from swollen eyes. So I guess the symptoms that I mentioned is sneezing and a runny nose, coughing, swollen eyes, itchy throat, and all of that. So this person basically has most of the symptoms except for the swollen eyes. And I have answered the question before. I think maybe in another video, or maybe also directly to people, actually. Yeah, on that thread, a comment thread, there's a lot of me answering questions because it's a popular video. So yes, you can develop hay fever anytime in your life. And what I want to say is that right now we are in the season where we have a lot of pollen in the air. A lot. Nature is on steroids, compensating for the long winter. So there's a lot of people that are experiencing hay fever symptoms and usually think maybe it's a cold, but then you realize that the cold doesn't go away even after 2 weeks. So then my experience when I used to work at a wellness clinic or a clinic, primary care clinic, a lot of people came in and were frustrated. And during those seasons, some of those seasons, it was also during COVID, which made it even harder for people to accept that it was just hay fever symptoms. They wanted treatment. Some of them think it's a virus. So it's really frustrating because even though you develop these symptoms, and if it's directly in this season, we cannot test what you're reacting to, what type of allergy reaction you're having, whether it's the grass that you're reacting to or the tree pollen. We have some trees that let out a lot of pollen that people react to. Something that I have noticed this season, because like I said, this season has been noticed that it's very, very, there's a lot of pollen. And yeah, so another symptom that I never mentioned in that video is hives. I've seen people this season coming in with hives, basically swelling or like face swollen, body full with hives, just itchiness all over the body, like as though you've been bit by something and you have an allergic reaction. That is also a symptom that you can get from this season, from the hay fever. It's part of the symptom. So what you should do, like I say in the video, go to a pharmacy and try out some antihistamines. It's a try and error thing. When it is full-blown season, summer season and spring season, there is no way that we can, we people working in the healthcare system, especially in the primary care system, it's very, very hard to start testing what you're reacting to. It's actually done after the season is finished. Then you can test what you have been reacting to. Now, then the next season, you make sure that you get this medication that you need, whether it's prescribed or you get it over the counter, and take your antihistamines. People are crying, thinking that they are misdiagnosed or just not taken seriously, especially people that are getting the hives. I've seen a few of them and they're like, nobody cares, we're suffering and everything, but there's so much medication over the counter. We're aware that this is happening, and people in the pharmacy, the pharmacists, are really helpful and can help you pick out the medication that you need. If either it's a cough or the hives or the sneezing, the coughing, the itchy throats, some people are just, not wanting to take their medication, which brings me back to compliance. I mean, if you have these symptoms and you refuse to take the medication, there's really not much that we can do, because even if you come in for a checkup and we realize that you are having a normal hay fever symptoms, then, well, they're still going to prescribe you basically the same medication, except that, it's on prescription and not over the counter. It's the same. So it's a try and error. Go get the medication, try it. And if it works, be consistent, take it every day. There are side effects, yes, and you can read on the package or ask the pharmacist and then choose when to take them. I know one of the symptoms is fatigue. You just basically are tired all the time. So I usually recommend those people to take the medication in the evening. So you're covered all day and maybe just can, the tiredness can happen, mainly during the evening. So then you go to sleep and then you wake up and, you're not as tired as you would be if you took it in the morning. So that's what I tried to explain to this person. We never talked about the skin reactions, but I told them, yes, you can get the hay fever anytime. Anyone can get it. Kids can get it. I had another friend of mine ask me about their child. Now, children are kind of tricky because you cannot really try out the over-the-counter medication, especially depending on how old they are. I believe this child was 4 years old. The medication, if I'm not mistaken, you should start taking it around, what age is that? I'll have to get back on that. I'm not quite sure, but a 4-year-old it's too early to just try it out. What you want to do is definitely book an appointment with the doctor and see what they have to say. And also depending on the severe symptoms, because this specific child was sent home from school, and they were saying, not school, but daycare, saying that they have a cold and they don't want the other kids to get the cold. But the mother is very certain that it's It's hay fever. So it's kind of a tricky season. It's disturbing when you want to be out and enjoy the weather. For people that have asthma, that is also an issue. In this season, when nature is on steroids, compensating, make sure that you top up with your asthma medication. Usually, you have to double your dose. People that have severe asthma are aware of that, but some of you that are have just discovered that you suffer from asthma and started treatment, you probably don't know. But ask your asthma nurse; will tell you that you have to double your dose. That could have some side effects, but it helps with the symptoms that you might have. And when the season is over, now you can go back to your normal dosage. All right. So that is hay fever. It's a huge thing over here, and I believe even back in Africa, I would say Uganda, Kenya, South Africa, we do have people that have allergies. And usually I've noticed that it's in the cold season. And what happens here is that people mistake it for, usually say sinuses, but they can't stop coughing, they can't stop sneezing, they keep on pulling this thing in their nose, nasal kind of thing. And some people actually even have the wheezing, which is not maybe an allergy, but something else, usually asthma. And you should definitely check this out. Don't just misdiagnose yourself and think, oh, it will just pass. Make sure you find out what it is. People that usually say, it's sinuses, it's this and that. It could be an allergy. It could also be asthma. So that's one thing that I wanted to add when it comes to a possibility of an allergy or asthma. Yes. So that was a long answer for one question, but it's because it's accurate right now. It's important, and it's right down the alley of this Q&A. All right. Next question. Let's see. Instagram question. Are there any scholarship opportunities in Sweden? Someone DM'd me about that. Scholarships, basically talking of, I think it was mainly for, I don't remember what he was studying, this person, but he just finished university and wants some type of scholarship to do further studies here. And my answer there was, depending on which, this is a very, very common question, by the way, that I get, especially from nurses that want to come here and study. What I can say when it comes to nurses, you can, if you're not a citizen of Sweden, you cannot do a bachelor degree in nursing. You can apply for a scholarship to do a master's degree. And I guess this is what I told this guy as well. Even if it's business or anything like that, I believe most scholarships are given for master's degrees. And they do have different websites. The one that I know about is the Swedish institution that gives scholarships. I do believe there's an Erasmus scholarship, or I'm not exactly sure if it's a scholarship, but I know the Swedish Institute gives out scholarships to master students, and you can come here and study, do your master's degree, and all of that is also the reason why. This is the reason why you cannot do bachelor's degree here. It's the language things, the language barrier, because most bachelor's degree are held in the Swedish language, while master's degree, most of them, not all of them, but many of them are held in English. especially at the, should I say, prestige universities such as Lund Universitet, Uppsala University, Linköping, Jönköping. You probably don't know where these places are, but I'm just letting you know. So this is something that is promoted basically for students abroad to come in and apply for this, because for us that are here, these further studies are free of charge. So you only need, money for your books and if you're working extra. So, but you can apply for this if you're abroad. I have seen students, many students from Kenya, Uganda, India, what other country? When I used to study, we had students from those countries. So if it's something that you're interested in, you can apply at the Swedish Institute for these scholarships. And of course, you have to be, what's it called? They have criterias that you have to pass basically to get that scholarship. Yes, so that was an Instagram question. I haven't really noted down who is asking this question. That was a bit, it was maybe, but people that DM'd me, I felt as though maybe it shouldn't be public on the questions that they ask, because, it's a personal message, a direct message. So I didn't want to out them like that. Okay. Third question. What type of nurse are you? Do you have a specialty? Great question. Yes, I do have a specialty. I am a general nurse, and that is basically what I do on a daily basis. That I work as a general nurse, but I do work in specific departments. And most of the times, because there's a shortage of nurses, they cannot just wait for that specific nurse that has done the special training. Maybe like oncology nurse, but even that you can learn at the workplace, maybe to mix the what's it called, to run the machines and all of that. But like nurses at in the OR operation rooms, maybe that I cannot do. And I rotate, like I said earlier, I rotate in my hospital in different departments. So like I do surgery, but I did that as a new nurse. But my specialty is I'm a diabetes nurse. I did that training. I did that course a few years back, and I worked as a diabetes nurse for 3 years at a primary care clinic. So that is one of my specialties, but I don't use that right now because I'm working as a general nurse at the hospital. And then I have a master's in public health that I also did a few years back. That I'm not utilizing either, but I'm planning to, I guess, maybe here on YouTube, because, it's public health information when I'm here. You would say that, right? But I do have that in my background, and I intend to use that, however that may be. But there are so many different specialties that you can do as a nurse, and they're basically just endless. There's the pediatric nurses, you have the nurse practitioners, there's the trauma nurses, oncology nurse, radiology nurse, psychiatric and mental health nurses. There are so many. Midwives are nurses as well. And I believe most of us, when I was doing my bachelor's degree, most of us wanted to become midwives. It was, something that was, I don't know, it was glorified for some reason. And many of us just wanted, I personally I still do want the training. I want to be able to deliver babies for some reason. It's just something that would be so beautiful to be able to bring, new life. I have been, personally, I should say, delivered a few babies, maybe. Not like, in my scrubs, but with my sister. That was the first baby that I helped deliver. My little baby, my sister's baby, who's turning 18 today. Not today, sorry, this month, this year. And the second baby was a friend of mine, and I was actually training as a nurse. And she fell pregnant, and she, for some reason, felt comfortable that she wanted me to be in the room, more than she wanted her husband to be in the room. And I wasn't even done my training. I hadn't done my training as a nurse, but yeah, we delivered that baby. That was a little girl. She's also a few years now. And then the last baby, I believe it was my cousin's baby. Yeah, so that was beautiful. That ended up into a C-section, but we tried for a long time. Yeah. So I've been there, the process, I'm aware of the process, but I want to do the actual training to become a midwife, maybe someday, fingers crossed. And the reason why I want to do that is from a personal point, because when I travel, especially when I travel back to Uganda, there's this trust and that is, put on your shoulders, that in case anything happens. And I'm afraid that if I end up in a remote village, I'll be put to the test, and I want to know what to do. But the good thing is that there's always someone that knows what to do. Women have been having babies for centuries, billions of years. That's how the world goes around. I don't have to tell you that. But my grandmother had kids, my uncles, by herself. I don't even know how she did that. Just my mom used to tell me, she'll go to do her work in the morning and come back with a baby with no help. So I'm thinking, you can learn this training. Maybe I should do that sometime when I'm in Uganda. Go for that training. What happens here is that you need the certification, you need some type of diploma, but really you can get a real life training as well. And I know the midwives here, because this country is considered to be a low birth country. So many of the midwives do their trainings abroad, because you need to have delivered at least 50 babies to get the real experience of what it is, because every birth is different, and that is really beautiful. So they usually go to African countries to learn. I know India is one, Asia, at least India, one of the countries where they go to. Pakistan, I've seen one of my friends that did the training went to Pakistan. So yeah, I'd love to do that. That is my specialty. I'm a diabetes nurse, and I have a master's degree in public health, and aspire to become a midwife someday. Yeah, that was a question. That was the third question, I believe. So let's go on to question number 4. What is the difference between a registered nurse and a diploma or certificate nurse? Oh, that's a good question. I actually found out about this, that they are, I didn't know until I came to to Uganda, and I was told that there are some nurses practicing with only a diploma or a certificate. I didn't know this, but I've gotten to know more. And for me, I've seen that this is an easier route for people that maybe don't go all the way to do a bachelor's degree and become a registered nurse. So you basically get practical training, and you get your certificate or diploma. And I believe there were so many different types of nurses there. But the biggest difference between a registered nurse and these other types of nurses is the credits. So the certificate nurses or diploma nurses usually study practical training for like 50 credits, while a registered nurse like me does university training, basically general education for 180 credits, which is the accurate credits here in Sweden. That's what I did for 3 years. So it's basically more intense and more. So basically, you are a general nurse and have so much more credits and knowledge and experience when you then start working. While for a diploma and certificate nurse reminds me of assistant nurses here, because when I was reading about it, they talked about nurses being trained to work as nurse aides or maybe in a elderly home. So that reminded me of that. But though back home we don't really have those, so these nurses are usually in the hospital as well. So well, I've seen some sit in a pharmacy and give like information on different diseases, and that I don't get either, because I wouldn't do that. I wouldn't really go into giving not medical information, but like information about medicines. I've seen them do that in some countries, but I've also seen that they administer medication. My uncle had a nurse that came and gave him injections, and I believe she was some type of certificate or diploma nurse. She was given the prescription and she was given the dosage instructions on what to do, and she did it. So I believe that's what they do, and then she cannot do much more than that. And also the different trainings, like nurse practitioners, for instance, they have a whole other training that comes to resemble like intern, like a doctor intern. And we don't have that actually in Sweden. We don't have nurse practitioners because I guess it's not something that nurses in Sweden are willing to do, because we already have so much that we have to do. A nurse practitioner actually will give you a diagnosis, and we don't give diagnosis. It's not part of our job. We do overall care for patients and administer medication and all of that. So yeah, that is something that does not exist here in Sweden, the diploma and certificate nurses. I haven't seen that. It's either you are a registered nurse or you are an assistant nurse, which is completely different. And I believe maybe they also have 50 credits. So maybe in other countries, they utilize assistant nurses as nurses for some reason. Yeah, so that is the difference, I guess, between a registered nurse and a diploma or certificate nurse. Yes, that was question number 4, I believe. Let me not get distracted here because the answers are really long. All right, so the 5th question was more of a suggestion and not really a question per se. It was said you should talk about diseases, their symptoms and treatment. Now, I don't know if this person was kind of annoyed over my vlogs that went on and on about, something else that maybe they were not looking for. But I have to say that type of content is there on my channels. I've talked about hypertension. I've talked about diabetes. I've talked about what else have I talked about? I've talked about respiratory diseases. Most of the NCDs I've talked about, the non-communicable diseases I've talked about because I had a theme where I made videos for every non-communicable disease. I had something about, so I've done that, and I agree with you. I should maybe update them and talk more about that because I see that it's something that people want to talk more about, and it's coming. Be patient with me, and don't lose hope. There's more content coming. Just stay tuned. It's not that I'm right now, since I kind of got a new audience, I have focused on these live streamings and vlogs rather than sit in a studio and film content like that. I did do, a video on travel health. But I do plan on, should I say, going back to the studio and filming more of that content where I talk about a disease and its symptoms and treatment and what you can expect. Well, my vlog about the mammogram maybe mentioned a little bit about breast cancer and symptoms. But yes, I hear you. I'm going to do more of those. I promise. Yes. So that was a suggestion, not a question. So I believe we're on the 5th question or 6th question. Nosy people that want to know. Okay, so are you married? Oh, God, you want to know all my business. No, I am not married. No kids, no man, and don't ask me why I don't have a man because even I don't know. So yeah, I am not married. That was a quick answer. We're not going to go any more into details about that. Let's try to keep it personal and no focus on that. Ooh, it's getting hot. Yeah, so more questions. You guys that are here, you are free to ask questions, so that can be answered here on this live, because that's what I promised you as well. So we're not only going to focus on these questions that I picked up on my channels. You also get to ask questions. So go ahead. What do you want to know? Other questions. I didn't write everything down, but we're going to have more of these Q&As, maybe not live all the time, but I'll make sure I get some of those questions and turn them into a video for you guys to watch. Yeah, I forgot something. The question about what type of nurses or what type of nurse I am, there is a new type of nurse that I forgot to mention, and it's the aesthetics nurse. Uh, Basically, I'm not sure how many of you are aware of this, but in the beauty market, there's aesthetics. The Botox and fillers and needling and all of that. So here in Sweden, there was a law passed uh, about who gets to give these injections. So what happened is that people were getting Botox and fillers from non-authorized people. Anyone could set up a studio or just give injections in their home. And this became a public health problem. People showed up in the emergency rooms with all types of symptoms and things, accidents that were causing them lifelong, basically, issues with, it just went wrong with these fillers, especially fillers, lip fillers. I'm not sure if you are aware, seen anyone, or been exposed to this market, seen people that have done Botox and all of that. But it became a problem here. And the solution was to make sure that people that were doing this, administering Botox and fillers, are now required to be registered nurses. So it's called basically that people that are handling injections, any type of injections, cannulas for aesthetics and in the beauty markets, you have to be a registered nurse. Hi, Rushikesh. So now that is regulated by the Swedish Socialstyrelsen. So that is something that was really good, because we had to pick up the pieces from these people that were doing it in the kitchens, in their living rooms. It was horrible. But now you have to be a registered nurse. Unfortunately, people are going for training, for a 3-year training, to work in the beauty industry. That is a negative part of it. But I think the positive part is that it's now regulated. This market is now regulated, and you have to get a certificate and training for this. Even people that knew how to do this before. Funny thing is, I went for that training. I went for a training for like 1 day, and I got the certificate. Of course, I wasn't comfortable. I know the side effects. I was just not comfortable doing this to people's faces. This is sacred. I mean, your face is. If you start changing this and something goes wrong, this is like, you're scarred for life. Now, I don't want to be responsible for that. I don't want to be. There's people that have actually got paralyzed because of this kind of treatment gone wrong. Yes, there are some really, really good doctors, because there are some doctors that also do the treatments, and they're the ones teaching people, nurses now, to do it. And the only reason they are doing this is because there's a lot of people that want this done, and it's a big business. So I find it sad because there's already a shortage of nurses, and now we have nurses going in just for this type of reasons to become aesthetics nurses, and just give this treatment. So they're not really interested in the care part of the nursing um, career. But that is basically, something new. I think that happened. The law was passed the same year that I actually got the certificate. I believe it was 2021, maybe. It's that late, and this is after so many complaints from the public and many insurance companies coming up and showing, that this is a public health problem. This is something that needs to be regulated. And I was happy to hear that, and to see that, it's been recognized as something that needs to be handled by properly trained personnel. I cannot do it still. Maybe more training, but I guess I'm a old school nurse that wants to do a different type of care and different type of nursing, I guess. That's just me. Yes. Matovu Abu, thank you. So do you guys have any questions? I've been just going on and on. Do you have a stethoscope? I do have one here in my house. Yes, I do. And at the hospital, we get those. We can, yeah. It's not, the one that I have here is my personal, but if I can show it, why? You can go back and watch my old videos. I do have it in some. I wonder if they're here and some YouTube shorts. I think I'm wearing a yellow stethoscope over my neck, so you can watch those videos. No, I don't want to show it in a live, because then that means I have to leave here and go look for it. I actually don't know where it is, but it's somewhere hidden. Thank you, Rushikesh. Thank you. So any other questions as we are wrapping up? We've been here for a good hour almost. So for those of you that came in later, this is a Q&A. I did answer questions live that were asked on my platforms, and you also get to ask questions here. What you want to know about Nurse Aisha, general questions, maybe one or two personal questions. We'll see if I can answer. Can God change a caterpillar into a butterfly? Is that science? Okay, that is not the type of work that I do, but I do believe a caterpillar changes into a butterfly. Yes, thank you. Wait, switch. I do have videos wearing the stethoscope. Yes, it is there. I don't know why people are so fascinated by that tool. We have so many other tools that are so fascinating that we work with, but a stethoscope has become something that you have to show. I was wearing it I was wearing it in a recent shorts, and someone commented why I was wearing it. And my answer to that was, well, maybe because I needed it, because we still use it to, we have new, should I say robots or machines, that we use to that are not manual. Hi, Tess. Hi. Yes, you have seen me with a stethoscope too. So yeah, what was I saying? Yeah, the stethoscope we use to actually take blood pressure manually, and also listen, to lungs and heart if we need to. I also use it if I'm administering. Oh my God! Now see me struggling with the English language. The the gastric thingy that you put, all the way down to yes, NG tube. Thank you. The NG tube, yes. So after you put it in, you have to listen, to actually make sure that it's in the right place. So then you hear the stomach growling. Yes. So the NG tube. When I do that, I have to use a stethoscope to listen. You are probably in the healthcare field. That's why you knew the NG tube. I know in the Swedish language, which is we do have two different ones actually. One for the feeding tube and another for in case someone has has to get out from their stomach that is not digesting well. So that I use the stethoscope for that. Otherwise, we have we rarely take the blood pressures manually, but if we have to, we use blood pressure thingy and the stethoscope to listen. I remember I used to have trouble with that when I was doing my training as a nurse. And my teacher, the training nurse that was training us was so angry with me. But I really need to understand things in details, and that can be frustrating for people that are training me. But I want to be able to learn it and practice it, and then also use it. So I have like a million questions usually. Yeah. So any more questions coming in? Anybody? So not to make this, because this live is going to be watched in after we have ended this streaming. So people are kind of complaining that the videos are long and they're kind of too busy to watch. So we have to limit the amount of minutes that are recorded. My last vlog was really, really long, but it's because I didn't want to miss a thing. And I also was told that some of the vlog, in case you guys have not seen it, it has been blocked in some countries because of the music rights. And I knew about that, but I tried my luck. I remember recording the first and also editing the first part of the video, and the music that was playing was tuned by a very big artist, and I knew that this could be a problem, and it did become a problem. So if you, probably people in America cannot see this vlog because it's partially blocked, but yeah, it is what it is. You will get to see other material at some point. So to keep it short for people that are going to watch this later, I suggest that we wrap up and I can get into the studio and film other videos for you guys. I hope you enjoyed this live stream, and make sure that you subscribe if you're not already subscribed to my YouTube channel. Make sure you watch the content that's already on there because I need the watch hours. We are working towards monetizing my channel. So make sure that you share these videos, make sure that people watch the videos. You can play them while you're cooking, while you're doing whatever you do, and get me to 4,000 watch hours. So thank you so much for watching, and I'll see you in my next video, vlog, or live streaming. Thank you, everyone. Have a good Sunday and a good new month of June. Bye.